with shifting our attention to the African scene. In Sierra Leone, the Ebola outbreak has crippled already poor healthcare systems where ambulances, medical staff, hospital beds and basic health kits seem to be in short supply. Ebola patients are said to even have been dying on the streets while burial teams are overwhelmed with disposing of bodies. Now, based on that, there were cries for help from the international community, and now they seem to be doing their part to respond to that.
After months of appealing to the international community for more assistance in fighting the virus, it appears as though the affected West African nations have begun to receive what they've asked for. The humanitarian corridor has opened, delivering massive shipments of personal protective equipment, medications, and teams of trained medical professionals. Yet, a daunting challenge remains: how to coordinate all these new resources.
The dimension of the crisis is so intense that developing the whole logistics operation for support is extremely complicated. This is a health crisis that is more complex than that goes beyond that. Trying to combat the health impact and at the same time to avoid the economic collapse of the three societies that have been affected is extremely difficult.
After getting off to a slow start, the international response to the Ebola crisis has gathered steam, with donors pledging hundreds of millions of dollars in aid. Britain's Royal Engineer team is building a 700-bed Ebola treatment center around 1.5 hours drive outside of the capital, Freetown. Cuba has sent 165 medical personnel, with more on the way.
The presence of the international community is very different to what we're used to see in any other humanitarian crisis. You have Cuban doctors with American health workers, British volunteers with Chinese lab specialists, Norwegian logisticians with American military. It is a combination that the UN will help coordinate for the governments to be more efficient in their response.
The World Health Organization trained 400 healthcare workers in Freetown 2 weeks ago to make up for the shortages of personnel after so many got infected. Some of Sierra Leone's and West Africa's top Ebola specialists have died in the current outbreak.
The operation right now needs to move to the field. The big challenge here is in Guinea, in Sierra Leone, in Liberia, not being only in the cities and in the outskirts of the urban agglomerations, but reaching out to where the epidemic is spreading. You will see the action in the coming days.
The UN Ebola response mission are providing 5 helicopters, vehicles and motorcycles to give community mobilization workers better transportation to trace potential Ebola contacts and stop the spread in cities as well as rural communities. The hemorrhagic disease that was originally discovered in 1976 has killed more than 4,000 people in this current epidemic.